Hey everyone, this is Mayor Robert Garcia, and we are doing another COVID briefing here for the city of Long Beach, and we do have a lot of information to share. I want to just start by mentioning that Kelly Colopy, who is our Director, of course, of Public Health in Long Beach, is joining us in this update. She is actually joining us not from this location, so we will be patching her in, and you'll be hearing her audio, so she can give a full briefing, and then she will also be available as both of us to answer any questions from any of the media that may have questions as well. And so just, we have a couple different locations for this today. I just want to make sure people are aware of that. And of course, Paola is doing our update today, ASL, and we'll be doing a Spanish translation at the end after the questions of the update. So I want to just start. Obviously, this is the week that we have Thanksgiving, and it's going to be a very different Thanksgiving this year for us across the country, and certainly here in Long Beach and in California. I want to start by just reinforcing what you're already hearing. Right now, we are seeing both a dangerous and unprecedented rise in COVID-19 cases across the state. In fact, hospitalizations over the last 2 weeks have been up over 75% across the state of California. The governor addressed this earlier today, and we know that statewide health officials are very concerned about the rate of the increase. It's not just who is in our hospital today, but the steady climb. If you look at graphs or the positive cases, for example, when we had the first surge months ago versus the surge that's happening today, the steep and the quickness of the climb is startling, and that's something we have to think about as the weeks ahead move forward. Here in what's going on in Long Beach, we have seen in just the last 3 weeks a almost 250% increase when you look at our hospitalization. Now, we had reported it was 200%, and that was a number that we had on Friday. Today, I'm told by our health department that that number is 248%, or almost 250%. In our Long Beach area hospitals, the ones that we of course gather data for, and the ones that we share with all of you. Kelly Colopy, who's our health director, will explain that a little bit more in just a few minutes. But that is a very disturbing increase, especially the speed of which it is growing. Our current hospitalization rate is around 60%. Now, if you remember, at the height of the pandemic earlier in the summer, we had our highs were in those low 60s to mid 60s, which is where we would hit that highest rate. So we are on our way to hitting those rates that we had hit just a few months ago. And probably most importantly, I have been in conversations with both the heads of the hospital systems here at Memorial and St. Mary Medical Center. Both have shared with me that they are seeing their numbers of hospitalizations quickly double, quickly increase like the city, and they support both the city and county's actions as it relates to additional restrictions, which I will talk about in just a minute. In some cases, they are also seeing more young people, pregnant women, and children being hospitalized with COVID-19. We have room today in our hospitals to take care of people that are sick. If your parent needs a ventilator, if your son or daughter maybe gets hurt for another reason, but still needs the hospital access. Today we have room. Their concern as hospital leaders is that if we keep the current rate of growth today, we will be in a very dangerous position just weeks from now if this current rate continues. And that's something that our health department team has heard not just from local medical personnel, but from regional and of course statewide personnel as well. It's important to remember that decisions around what stays open or closes is first set by the state's tier system. But those decisions within those tiers are made by doctors and medical personnel that are looking at the data. Another example here in Long Beach. Just 2 weeks ago, we had approximately a 3% positivity rate. Today, it's at 5.8% and going higher. And also disturbing, Long Beach at its height during the last surge had done at its highest levels about 1,900 tests a day. That was the highest we'd ever done. On Friday, we completed 2,500 tests. It's the most amount of tests that we have ever completed in the city of Long Beach. And Monday through Friday is when we have as a city the most capacity to do tests. And while over weekends there's sometimes less capacity, we're going to get a better picture over the week ahead and 2 weeks ahead if that trend continues, which is going to put a real strain on our testing capacity. And we're very hopeful that we can provide the number of tests that we're going to need if these trends continue. And so what this data tells you is that things are serious, and I think you're hearing that from all levels of government. And while these numbers are certainly worrisome in California, much of the country is even doing worse. You look at what's happening in the Midwest or in other places, this is a time to get serious and continue to take this threat very seriously. I want to also address the difficulty that these types of actions have on our community and our economy and our workers. Just over this weekend, Dr. Davis, who is our public health officer, of course, put out a statement and the intention of our Long Beach Health Department in partnership with Los Angeles County and the state to, of course, have some additional closures as it relates to outdoor dining for restaurants. Now, I will say that this has been very, very hard. I know many of these restaurant owners personally. I know the workers that are working so hard to take care of themselves and their family, and it is a devastating loss for them, the workers, and for our economy. The risk for them, the financial damage is serious, and we are heartbroken that we are in this health pandemic and crisis. I also know that one of the most important jobs that I have and that the health department has is to ensure that if your mom and dad is sick, that they have a hospital bed available and waiting for them at one of our hospitals. That if your sister or a family member needs a ventilator, that they're available in our hospitals. And so what you're seeing here in Long Beach, across the region at the county and at the state, is trying to restrict the spread and encourage the wearing of masks and discouraging gatherings this coming Thanksgiving and in the weeks through the holidays ahead, because we know that the flu and the cold weather are going to make things worse. Let me, before I turn this over to Kelly, also say one more thing. Earlier today, I joined a group of bipartisan mayors. There was a group of us that had a virtual meeting with President-elect Joe Biden and Vice President-elect Harris. And at the top of that agenda was COVID-19 and the economic recovery for cities. We do expect, with this administration, a significant recovery package that will allow us to make some strategic and serious investments back into the city and into our economy. We, of course, advocated for this today, and the Vice President Biden and Senator Harris, soon to be President and Vice President, concurred that this plan is, of course, in the works, and we've heard some of that in the media. I want all of our businesses, particularly our restaurant owners and our workers, to know that we have two priorities, and I certainly have two priorities when these funds come back to the city, of which they should be pretty significant. One will be to ensure that our health system is strong and that our hospitals and that our medical teams and our testing centers are ready for vaccine distribution and for testing. And the second will be direct economic relief to workers and the small businesses that right now are seeing incredible losses to their financial picture, their families, and their businesses. So I know that isn't a huge relief for what people are going through right now. Please know that in the weeks ahead, we will be reaching out to our business community and to our workers and putting together what I hope will be a significant financial support package for the community. Let me turn this over to Kelly Colopy, who is our director of our health department. She'll go over into some more of the details, and then we will open it up for questions.
Go ahead, Kelly.
All right, good afternoon, everybody. As the mayor has discussed, our numbers are increasing rapidly. We've had over 120% increase in our case numbers within the past few weeks, and which is a much steeper curve than we've ever experienced in the past in terms of increases. We've gone from a positivity rate, or we're now at a positivity rate of 5.81. We were on November 1st, we were at 2.9, which was our lowest point. So over the last 3 weeks, we've seen a significant increase in our positivity rate that also now falls above the LA County positivity rate. Our case rates, which you've heard us talk a lot about. So, 7 was the magic number to be able to move out of the purple tier, and we were as low as 6.9 for a day. At this time, if you take the 7-day lag, we're at 23.3 per 100,000 for the case rate. If we remove the lag and take just the last 5 days, we're at 34 per 100,000. So the numbers are increasing rapidly, and the percentage of people within the city of Long Beach who are testing positive in the last 5 days has increased significantly. The other piece is the hospitalizations. So what you see sometimes are the numbers that are specific to COVID cases for the city of Long Beach. And we see those numbers increasing. They've increased by almost 100% in the last 3 weeks. But what we also pay a lot of attention to is the capacity of our hospitals. There are 5 hospitals that we consider as our local hospitals, and they're what we track together. So that's Memorial and St. Mary and College, as well as Los Alamitos and Lakewood, because many of the people who live in the city of Long Beach utilize all five of those hospitals, but also people from surrounding regions also use those hospitals. So our goal there is to make sure that there is capacity in those hospitals to be able to treat people, not just for COVID, but for all illnesses. And if our COVID numbers go up too quickly, then they would not be able to support people for other illnesses, emergencies, and others. As the mayor mentioned, since November 1st, we have gone up 248% in COVID cases in our local hospitals. And so there is concern there. The heads of our hospitals are very concerned about what that looks like going forward. In terms of our testing capacity, we are now testing higher than we've ever tested, even during the summer surge, when businesses were sending people to make sure that they could come back and go to work and other things. So there is a significant focus on testing right now. We do have capacity. We have the ability to expand lanes if needed. We have sufficient staff as well as testing kits to be able to meet the need. At this point, we continue to have a 3-day appointment scheduler. We are full for tomorrow and Wednesday, but we do have appointments available coming online for Thursday. So you can still get appointments within the 3-day time frame, and the testing turnaround time remains 48 hours or less. We do continue to see most of the cases and the case increases in ages 25 to 49. So it's a lot of younger folks we're finding who are out and about where the focus is. So that's the main update. We are coming into Thanksgiving. we are coming into a holiday season. We are encouraging everyone to take the most precautions possible, and that if you choose to be with your family members that are not in your household, that you do so outside, that you do so with your 6 feet distancing and keeping your mask on for all time except for when you are eating, and that you really pay attention to the risk, those who are around and who they'll be going home to. Going forward, we really want to be able to begin to steady things as much as possible during this time frame, and to support all of you as we go forward. So with that, I'll turn it back over to the mayor.
Thank you. We'll go ahead and do questions.
Great. Thank you. We'll now move on to media questions. We'll be taking one question each. Any follow-up media questions can be sent to the Long Beach Joint Information Center. First question comes from Elena at the Business Journal. Go ahead, Elena.
Hi. I wanted to ask, restaurants have offered outdoor dining for months. The current spike in infections is more recent. Is there any data that suggests that outdoor dining plays a significant role in the spread at the moment?
Kelly, go ahead.
Well, what we really see with outdoor dining is it is the one space of any business that is allowed to be open where people do not wear their face coverings. So it is considered one of the most risky of the environments, because people sit together, and although it's tables of 6, many of those people are not from the same household. So it is the only place within the current orders that allows for people who are not within the same household to sit together in close contact for up to a couple hours without a face covering on. So that's been a real concern overall. And what the county and what we've been seeing overall is that there's about a 20% non-compliance rate among restaurants in terms of all the different things that we need for the social distancing, how things are set up, how people are waiting in line, and all of those different places. So that is the key focus where we're putting. That's what the key area, or the key reason why we are focusing on restaurants at this time.
All right, thank you. Next question comes from Crystal at the Long Beach Post. Go ahead, Crystal.
Can you guys hear me?
Yes, we can.
Okay, great. Thank you for allowing me to ask this question. So, has everyone been sick this whole time, and it's only really showing because they're getting more testing because they want to mingle for the holidays? Just because.
Cut off.
And they're all booked right now, but not really on Thanksgiving. And if so, do you expect the positivity rate to continue to surge?
Crystal, I think you cut out there for a moment. Are you asking if people have been sick all along, but they're just getting more testing now, and so we're starting to see the numbers? Is that the gist of your question?
Yes.
Okay.
And if so, do you guys also expect the numbers to continue to rise in terms of positivity rate?
Kelly, can you please answer?
Yes, you did cut out a little bit, so I want to make sure I get the answer. So, yes, what we're seeing is that as the community spread continues with the coronavirus, we are seeing people have been gathering more, and we're seeing increases in our younger folks. And so as the spread continues, now with the upcoming gatherings, the upcoming holidays, the concern continues. So it's not that people have been ill all along and are now deciding to get testing necessarily because of the holidays, but there is an ongoing concern because of it, because we're seeing more of it throughout our community, and that people are being tested. So I think the positivity rate is going to continue to increase. Our case rate, we anticipate, will continue to increase, particularly if people do not really practice the safe social distancing practices over this holiday season.
All right, next question comes from Haley at the Press Telegram. Go ahead, Haley.
Hi, so thanks for taking my question. If the case rate and hospitalizations continue to climb, can you speak to what other actions or restrictions the city may put in place to slow the spread?
Kelly, I'll just say one thing and then I'll turn it over to you. I'll just add what we've said this entire time is that everything is always on the table, and we have to use every disposable action to help save lives and keep our hospitals at a point where they can actually intake new patients. And we are preparing right now, obviously, for any worst case scenarios. We do have obviously some mobile hospital opportunities to expand at the convention center and other things. If we get there, we hopefully will not have to get there. That is compounded with the fact the CDC is reminding us that this season and the flu is going to make naturally this pandemic harder to manage. And so we're trying to manage all of that. Everything is still on the table, but no one enjoys, and the health department does not enjoy shutting down businesses. It is awful for them. They hate doing it. And trust me, they are pained when they have to make these decisions. And Kelly, I don't know if you want to add anything to that.
Kelly, go ahead.
Yes, I think, each step that we take, we weigh very heavily in terms of what that is and what the impact is on business owners and others in the community. We certainly know that overall wellness it has so many factors. And so right now we are really focused on ensuring that we have hospital capacity during a time when people are really beginning to go indoors more, spending more time indoors. As the mayor said, we're looking at a lot of different options. We are also ensuring that we have, if our hospitalization rate continues to increase, that we have the capacity for overflow. We are also, we're hearing about immunization, which gives us some hope, and we are preparing. We have a solid plan for mass vaccination. So as soon as the vaccine is passed and is ready to come through, we are set up and ready to go for that next step. So we may have to take more steps going forward to sort of bridge to the point of the vaccine. But at that point, we will be ready to do the mass vaccinations across the city to provide protection.
Great. Next question comes from Kelly at the Long Beach Post. Go ahead, Kelly.
Hi, Kelly. We've talked before about surge capacity at hospitals. Our hospitals are about 60% capacity right now. What level would we have to reach to where we may start having to consider mobile units, the convention center, and other options?
Go ahead, Kelly.
We can set, can you hear me?
Yes, we can hear you.
Okay, just make sure. So we can set up additional, we have mobile hospital units that we can set up outside of hospitals. They were set up previously. We can set those up within 24 hours, as well as alternative sites. So, as we're moving up there, the hospitals also have some surge capacity on their own by shifting beds and doing some other things. So it's really, there isn't like a percentage that we look at and say, this is it. It's a whole bunch of factors that come together in terms of staffing at the hospitals, in terms of different spaces and things. And we'll be working very closely with them in partnership to understand, each of the next steps in terms of surge capacity.
Okay, and we have one more question. This came over email from Ryan Carter with the SoCal News Group. This is for the mayor. With Thanksgiving upon us, what are you thankful for this year, given all you've been through? When you sit down to reflect on that thanks, do you have a different perspective on Thanksgiving this year?
Well, thank you. I obviously, this is going to be a harder Thanksgiving for me and for, quite frankly, a lot of families across the country that will be experiencing their first Thanksgiving or their first Christmas without members of their family, and for me, for my mom and my stepdad. I'm still thankful that I have the rest of other members of my family that are healthy and alive. And my real just hope for for this year, my husband and I are gonna stay home and have a Thanksgiving just the two of us. My hope for everybody else is to do the right thing this year and to preserve your ability to enjoy your holidays with your family. in the future by just this year, just sacrificing this year's holidays so that we can enjoy all those in the future. But I still continue to be thankful for this community and for our city and for just all the blessings that we still have in our lives. And I'm also hopeful that there is light at the end of the tunnel. And if we can just continue to sacrifice and keep each other safe, early next year in January, we are going to start seeing people getting access to the vaccine, particularly essential workers first. And that is going to be a huge shift in the way we deal with COVID-19.
Thank you, Mayor. That concludes our questions, and now we'll move on to some remarks in Spanish.
Okay. Gracias. So hoy día la persona que hace la transacción en español no pudo estar con nosotros. So yo voy a tratar de translazar un poquito lo que pueda hacer hoy día. Déjame empezar por decir que quiero agradecer a todos por tratando de hacer lo mejor que puedan para que tengan sus familias seguras en este tiempo de COVID-19. Sabemos que en el estado ahorita los números están bien terribles para el COVID-19 por todo el estado. A 75% over las últimas 2 semanas han crecido en las hospitalizaciones por todo el estado de California. Y eso también está pasando en todo el país. Acá en Long Beach, en las últimas 3 semanas, hemos visto 250% que se ha incrementado por los que están en el hospital, en los hospitales acá en la área de Long Beach. Y en Long Beach, 60% de nuestras cuartos y camas están usadas ahorita por COVID, por la situación. So, tenemos todavía la oportunidad de tener más personas en los hospitales, pero tenemos que cuidar que no ese número de 60% no crezca mucho más. He también hablado con los directores del hospital en Memorial Medical Center y St. Mary, y ellos apoyan a las decisiones que está haciendo la ciudad de Long Beach, el condado de Los Ángeles y el estado, como tener que cerrar negocios, que yo sé que es bien difícil para la comunidad. Hace 2 semanas, el porcentaje de casos positivos estaba a 3% en la ciudad de Long Beach. Hoy día está a 5.8%. So, sabemos que el porcentaje ahora está mucho más grande y es algo también que debe tener mucho cuidado. Por exámenes de COVID-19, el número que teníamos más grande hace meses, que era 1,900 exámenes de COVID-19, fue el número más grande que tuvimos. Este viernes hicimos 2,500 exámenes de COVID. So, los más que hemos hecho desde que empezó esta pandemia, y eso es algo también que tenemos que mirar, porque eso es bastante gente que está viniendo ahora para tomarse examen en nuestros lugares de examen. Y si eso continúa, vamos a tener capaz tener problemas en nuestros lugares de exámenes porque tanta gente está tratando de tomarse examen. Quiero decir que también es bien difícil. Sabemos que restaurantes van a tener que cerrar su operación para comer afuera, y esto está afectando a los que están trabajando y los que también tienen los restaurantes, y es bien difícil para nosotros porque sabemos que es difícil para la economía, para ellos, para vivir y para sus familias. Quiero también decirles que hoy día tuve un meeting virtual con el nuevo presidente Joe Biden y la nueva vicepresidente Kamala Harris, hablando con alcaldes por todo el país, y ellos están hablando que van a poder tener una ley que va a tener dinero y apoyo para ciudades para que podamos ayudar a nuestros negocios y los que están trabajando. Para nosotros en Long Beach vamos a tener dos maneras que vamos a mirar esos dinero. Primero, queremos ayudar a nuestros hospitales, departamento de salud y lugares para tomar examen. Y el segundo va a ser para ayudar a los negocios, a los restaurantes, a los que están trabajando, para que puedan tener apoyo en este tiempo bien difícil. Sabemos que este es un tiempo bien difícil. Yo sé que ahora viene el día de Thanksgiving y también Navidad. Por favor, que cuídense con la comunidad. Estamos en una situación bien difícil, pero cuide tu familia y por favor también no se pongan todos juntos a esta semana. Muchas gracias.